because it's the first one of the first journal that dedicated this topic in surgery, AI, metaverse, and all innovation. So I want to thank also my friend, Professor Mohamed Ansari, for the collaboration, for the amazing presentation about different options to use in clinical practice, metaverse. And I want to thank you also, finally, the Professor Xing for amazing presentation about AI in thoracic surgery, and different options in transplant, in screening, and immunohistochemical and molecular analysis. Yeah, I will talk briefly about our experience in the metaverse, in surgery, with the metaverse in surgery. But before, I would like to share with you some consideration about the new technology. About the new technology in health, because it would seem that where there is a good communication, so just said by Professor Yaxin, there is a good health. And it would seem that in this mean, where there is a good communication, we have an improvement of the outcomes of the patient and the reduction of the cost of the hospital. So it is to be understood between colleagues, between medical doctor and parents, between medical doctor and patient, and between medical doctor and the management of the hospital. This concept has been already proven in research. In fact, until the research were divided and looked in their room, the progress was slow, no? After, with the introduction of a new method of research, the translational research method, with the Skyway, the bidirectional bridge from bench to bed and from preclinical to clinical, today we have an infinite amount of knowledge and information who transformed the medicine from evidence-based medicine to tailored therapy to today precision medicine and surgery. So with a multidisciplinary evaluation of the patient, each with their skill. And in my opinion, this is the most important moment that the knowledge, the new technology can do its work. Because in this context, the new technologies can support to have the health to have a better result, but not to replace us. So not to replace the mind of the human, but to improve our work. And in fact, in the 1957, an American genetist Huxley defined transhumanism, the man who remains human but to transcend himself for his human nature. So to support our mind, but not to replace us. And based on this concept, we landed on the moon. And in our fields, we certainly the principal goal, the principal aim is the pharmacogenomics. So to care the disease, to care the patient before clinical manifestation. But in our fields, in particular in surgery, in our fields, we today use in clinical practice different technologies. So 3D reconstruction for navigation in upper GI surgery, for example. Simulation to improve the learning curve of the young surgeon. And today, very important is the use of AI in endoscopy to treat the early form of precancer lesions of pancreas, for example, where the surgery is very difficult. pancreas, gastric cancer, so gastric surgery, and colorectal. But today, in 2025, we can see that an important take-home message is also the importance of teamwork. And in the health, this concept, we have an evolution of this concept, because in the clinical practice is based on the new concept that is defined the design thinking in healthcare, a concept that underlines the importance of multidisciplinary collaboration to solve complex problems. We can see that all start from the idea, the brainstorm from one of the team members that need to be discussed, presenting solution and put in clinical practice to care the patient and the disease. For the new technologies, we focused on the metaverse because we think that metaverse is an effective technology because we have advantages into the group. We can personify ourselves with the avatar. We can teleport. There is the teleported with hologram. We can share videos, 3D reconstruction for planning and follow-up, live surgery. We can do oral telementoring for laparoscopic surgery and practical telementoring for robotic surgery, connecting the console remotely, for example. And we think that Metaverse is an efficient technology because we can have advantages outside the group, reducing cost of human and economic resource. We can see that in 10 years, from 2023 to 2034, we have an increase of the metaverse with an increase of financings for metaverse only in surgery operation market, with an increase of computed average growth rate for technology and user and our application. And in 2023, we showed our first results and data with Professor Moana Danansari, published in National Journal of Surgery, Surgical Innovation, Update in Surgery, and lecture notes in Computer Science. So our experience started in January in 2023, when we participated at the inauguration of Metaverse Hospital USA, projecting the first laparoscopic cholecystectomy and the first laparoscopic left colectomy into the metaverse, discussing, for example, the critical view of safety for every step of the surgery, identification of the calot triangle, isolation and section of the artery and cystic duct for cholecystectomy, or isolation and section at the origin of inferior mesenteric artery vein for left hemicolectomy. On June 2023, we organized the first hepatobiliopancreatic surgery workshop into the metaverse, sharing scientific presentation from professors of different universities, sharing surgery videos, 3D reconstruction, and live surgery with the first robotic left hepatectomy into the metaverse. On February 2024, during the Iraqi Medical Conference, we performed into the metaverse the first robotic right colectomy, and we can see that after a simple setting of virtual hospital and real operating room, it's very easy to share and follow procedures even from your smartphone. After, we performed also the first immunohistochemical and morphovolumetric analysis to improve the second opinion or the first diagnosis remotely. On December 2024, we organized the first webinar titled The Importance of the Metaverse to the Modern AI Surgeons, in this journal, Artificial Intelligence Surgery Journal, for the editorial board member and for the members of the International Society of Digestive Surgery with Professor Walsh. On January 2025, we performed the first in-flight consultation in a specific in-the-flight experiment titled Avatar Flight Rescue Medical Team to improve a consultation or the first indication for emergency or urgency emergency treatments during the flight from Rome to Dubai with the Wi-Fi network with the cabin crew availability. The research and our activity research continues in this direction with the creation of a new alarm CubeSat nanosatellite, particularly for the health. And in this way, we perform the first connection, emergency connection, from between smartphone and Metaverse Hospital, USA, with a call, emergency SS call. I want to underline that there is an important interest in this research in this way from all agency space from all over the world. And there is a very interest for the robotic surgery remotely in the absence of gravity to make space mission safer. So the topic is very important in not only in the health, but in the global science into different fields. So I thank you all. I would like to conclude with a sentence of Henry Ford that said, there is a true progress only when the advantages of a new technology become available to everyone. Thank you very much.